Hey guys, this is Charity Stanley, and we are going to be talking today about anger and hostility in patients and ways we can deal with that. And so, the big thing is, as a healthcare provider, you have got to learn how to de escalate situations. And we've talked about several ways you can do that already. One of which is going to be talk quieter and when somebody is becoming more aggressive, and they will calm down to be able to hear what you're saying to them. So, big thing with anger is that it's a normal human emotion. Anger is, we deal with anger and we deal with fear every day. And anger is externalized fear. So, it happens when somebody is frustrated, hurt, or afraid. And big thing is, if anger, all anger is, it's an indicator. So, and it's an indicator just like the dashboard light saying, hey, your car's overheating. You need to stop before you do damage to your car. Anger is just an indicator like that. It is telling you that there is something going on in which you are angry, frustrated, you're scared. And so it's an indicator that you need to make some choices. The body is ready for self defense. So this is going to be your fight or flight. And I would add to that that you are ready to fight, you're ready to flee, or you freeze when you become angry, when you become very, very scared. So, the way we deal with anger is a big part of psychology. So, we can either deal with it constructively. So, my mom, when she would get angry, she would clean the house and she would be scrubbing things. So, my sister would come in late and miss her curfew. Mom would be up at 2 a.m. scrubbing the stove. And so that is one way to deal with anger. Another way to deal with anger is through inappropriate expression. Okay. So, inappropriate expression of anger would be pretending it doesn't exist. That's suppression, or acting out and putting holes through the wall. That would be an inappropriate expression of anger. Hostility is when aggression comes out verbally. You will see tons of verbally aggressive patients. And so, with that, you have got to set boundaries and let them know what will be accepted behavior, what is not accepted behavior. And so, hostility increases when a person feels powerless. When a person is in the emergency room, they often feel powerless. They also feel that their existence may be threatened. Physical aggression is when you're attacking another person or you're actively destroying property. So both are meant to try to control another person and force them into doing what it is that you are wanting done. So anger is often perceived as a negative feeling. It really isn't a negative feeling. It is an indicator, just like the indicator on your dashboard is not positive or negative. It is just a feeling. It is not healthy to ignore the lights on your dashboard. And so it's not healthy to ignore feelings of anger. Inappropriate expression leads to hostility and aggression. And often, if you will just talk about what is bothering you, that's catharsis. You just talk about truly what's upsetting you, frustrating you, that helps to take away the anger. Cognitive behavioral therapies are frequently used with people who are angry because it helps them to be able to reframe the anger. Why is this frustrating to you? What is underlying this emotion? And it is considered to not be polite or kind to be angry. And so frequently you will see women suppress their anger, but it always has a way of coming back. So the more you try to push away emotions, the stronger the emotion comes back and will often come out when unexpected. Hostility can be very sudden. It can be unexpected. It has different phases. So something triggers the hostility and the aggression. And if you can deal with it at the time that the person is triggered, before it starts to escalate, then you're able to deal with it in a more effective way. Triggering is going to be the initial frustration, the annoyance. Escalation is going to be where yelling often increases. Crisis, when the physical damage is being done. Recovery, the immediate aftermath, and then post-crisis. Hopefully they can learn something post-crisis that will help stop the cycle from happening again. So there's several related disorders. People, when they're hearing auditory hallucinations, it can be very difficult for them to discern what is actually their thinking and what is the other voices that they're hearing. They can become very paranoid. Aggression happens a lot with dementia because dementia patients are so frustrated by not being able to access and interact with other people the way they have in the past. Intoxication with alcohol or other drugs, it lowers inhibitions, makes you more likely to act out. People with antisocial personality disorder, poor social skills, borderline personality disorders, the splitting, the black and white thinking. You're either all good or all bad. You can't be a mix of either. Depression, intermittent explosive disorder. This is going to be when these day-to-day triggers and frustrations aren't being dealt with. And so intermittently, often without knowing what the provocation is, an explosion happens. And then after the explosion, the person's fine again until they intermittently explode again. And also acting out is a part of hostility as well. Why do people become very aggressive? There's some different theories behind it. The first that we're going to look at is the neurobiological process. That's going to be due to decreased serotonin. So increased dopamine and increased norepinephrine. Norepinephrine is the trigger for our fight and flight. That's our gas pedal. So if we have increased fight or flight, and we have increased dopamine. Dopamine is going to be our reward centers, okay? Then we're going to have the ability to become very hostile, very aggressive. So ways we would treat this is through increasing serotonin, through taking SSRIs can often be used to help treat aggression. Psychosocial theories, this is going to be looking at failure to develop impulse control due to poor parenting, due to dysfunctional childhood homes, inconsistent responses to children's behaviors. So they never know what they're doing, if it's right or if it's wrong. Also can be due to interpersonal rejection. And we've seen that with some of the school shootings. Interpersonal rejection was the triggering event that caused acting out violently. There's several cultural considerations as well in the expression of anger. So social determinants of health have caused health disparities. And so what this means is where you are born can affect your health throughout your life. Now, your family of origin was not your choice. Many of us would have chosen different families of origin had we had that option. But the social determinants of health from your families of origin can often cause changes in our health based upon factors that we have no control of. One of those factors is culture. So within the United States, we have culture-bound syndrome, anorexia. So the only countries in the world that have patients that develop anorexia is within the United States and within France. So what is in common with these two very different, both geographically and culturally, um, that they would still create the same syndrome and control being exercised through refusing to eat? And it's within our culture and within the French culture, being thin is very much rewarded and it is very much desired. Both the United States and France are both prominent within the fashion industry. And with that, it becomes a culturally bound syndrome because that is the way in which people will exert control to fit in with society, is through refusing to eat. Other culture bound syndromes that involve anger and aggressive behavior is going to be hwa byung, and that is within Korean culture. Frequently, this will be Korean women, and their anger is suppressed to the point that it creates somatic problems. And they will have severe abdominal pain, or they will feel like that their anger is creating a tightness within their chest, and that they often will report it as they feel like their chest is going to explode. And so the way this is treated is through counseling and helping them find better outlets for their anger. Buffet délirante is French. And what this is it's actually been removed from the DSM-5. But this is when somebody explodes quickly. And what this means is they have an intense verbal output of aggression. And they often will not remember what exactly what was happening that was the trigger or what was said. And then our last one that we're going to look at, we talk about people running amok. Well, this actually isn't just a cultural idiom with running amok. Run amok is actually a cultural bound syndrome. It's often seen in Southeast Asia. And what will happen is somebody will lose the ability to control their behavior. They will take a weapon and anyone who is within their path, they will destroy. Anything that is within their path, they will destroy. And that is something that often only happens once within a lifetime, but they call it running amok within the society. So our treatments, we want to focus on treating the underlying psychiatric problems. So if it's bipolar disorder, look at lithium. And lithium can also help stabilize conduct disorders. Remember, conduct disorders are in children under the age of 18. And frequently, children who have conduct disorders will be called antisocial personality disorders over the age of 18. Carbamazepine. Now remember, with carbamazepine, big side effect is agranulocytosis. Carbamazepine can be used in patients with dementia or personality disorders. This is going to be the very severe effects of personality disorders. Most personality disorders aren't something that you will treat. Can be treated with atypical antipsychotics. Remember, these atypical antipsychotics, the big side effect is going to be weight gain, but they are safer from EPS symptoms than the typical or first generation antipsychotics. Atypical antipsychotics will often be used in cases of traumatic brain injury, dementia, etc. Benzodiazepams are used within dementia. Now, there is a problem with using benzodiazepams within dementia patients because frequently dementia patients are older and they have other comorbidities. And if I'm giving a dementia patient benzodiazepams, they already were a fall risk prior to receiving the benzodiazepams. The risk for falls and other injuries related to those falls increases significantly with use of benzodiazepams. Haloperidol. Haloperidol is often used to decrease agitation, also used to decrease psychotic symptoms. Now, we have haloperidol and we also have Geodon. Geodon, both are used to decrease agitation. Halidol hits faster than Geodon does. With Geodon, you often have to use other kind of behavioral treatments in the short term. It usually takes about 20 minutes or so for Geodon to really take effect. And typically when it does take effect, it makes your patient very sleepy. So the nursing process, looking at assessment, you need to be aware of different factors that increase aggression. So the way that you're talking to patients can increase aggression. Your body language can increase aggression. Individual clients, one of the biggest predictors of violence in the future is violence in the past. Find out how a person handles their anger and look at their behavior to see where they're at within the aggression cycle. So common problems within the nursing process that they will have is risk for violence and ineffective coping. So if I can give a person better skills to cope with their day-to-day frustrations, and I can change the reinforcement that they get for acting out, I can improve their functioning day to day. So ideally, we work with the patient and we teach the patient to not harm yourself or threaten others. Now, self-harm, we've already talked about. Self-harm can be a way, it could be anything from scratches, cutting. It's a catharsis for that person. Teaching people what are intimidating and frightening behaviors. Sometimes people don't understand the effect that their personal behavior has on others. And it's important to describe feelings without aggression. And this can be very uncomfortable for many, many people, especially men, because we are, as a society, we want them to be our caretakers and our protectors, but at the same time, we want them to have a sensitive side as well. And that has not been conditioned into males. With females, we're always talking about our feelings, talking about what do you think about this? And with males, that is not conditioned. And so when they start to have feelings that they don't understand and don't know how to process, it can come out with aggression. You want to make sure that you are taking care of these patients in the least restrictive way. And it is best to be able to stop the aggression early within the cycle instead of waiting and letting it completely explode and then dealing with the aftermath. So how can we manage the environment? We can have a schedule. We can have planned activities. We can schedule one-to-one interactions, one-to-one check-ins, helping that person be able to identify what these feelings are and appropriate coping. Also, we want to make sure that we consider the safety and security of other patients. Now, as we've talked about before, what you want to do first and foremost is keep yourself safe. And what that means is if somebody is in the process of escalating, You want to yell for help. You want to get other people there. You want to help protect the other people in the room, get them back to their rooms. So you want to consider the safety and security of other people as well. So manage the aggressive behavior, approach them in a non-threatening and calm manner. You want to convey empathy, help them understand that you have these feelings as well, and that there's better ways, more comfortable ways to cope with these feelings. When somebody's angry, they have trouble processing complex information. So use clear, simple, concise sentences when you're communicating. Allow them time to talk. Help them to recognize ways that they can calm down. Suggest they go to a less stimulating area, go to a quieter room, offer PRN medications, suggest physical activity. Often anger can be channeled in other ways besides anger and aggression. So if they're in the escalation phase, you've got to take control, provide directions in a firm, calm voice. This is going to be command presence, is what they call it within law enforcement. So when a police officer shows up at a scene, they take control of the situation in a firm, calm voice. You want to separate the people that are becoming aggressive. Communicate that aggression is not acceptable. Show of force. This is when police officers bring backups and show that they are outnumbered. So offer medications. And if they're continuing to escalate, getting to the crisis point, you may have to give them the medications involuntarily, as in hold the patient down, give the medication. And that will also be involved in the show of force. So if they're in the crisis phase, then you take charge of the situation for safety. You restrain. And this, with children, we'll often call this therapeutic restraint. And that means they literally are sitting on your lap and you are holding them. So in addition to holding them, that helps to increase the oxytocin in their brain. But only people who are trained and know how to restrain a patient should be involved in the actual restraint. And it will take somebody for each limb and somebody to help hold the torso and be able to control the head, because often when you start to control the limbs, they will attempt to bite. So you've got to be able to control different aspects of the person and let them know that they are out of control and that you are restraining them for safety, for both your safety and for their safety, so they don't hurt themselves. During the recovery phase, you want to talk about what happened, help the client to relax or sleep, figure out ways that they can express themselves and deal with the aggression other than acting out aggressively. Assess and document, take pictures of any injuries, let staff know what has happened. This will include staff on the other shifts, because once somebody has acted out violently, they're more likely to act out violently in the future. And encourage the other clients to talk about their feelings. Now, where you have to draw the line is when you are talking with other clients about their feelings about what happened. You cannot go into detail about what is going on with that person in particular. The key is to talk to the clients about how they felt when that aggressive situation was happening around them. During the post-crisis, when the person has calmed down, remove them from restraint, calmly discuss behavior. Don't fuss for their behavior earlier. Just let them know that that behavior is not tolerated, and give the client feedback. How can they maintain control? So as soon as you can reintegrate them into the group, allow them to go back to the group. During the evaluation aspect, the care is most effective when you're able to get rid of the anger or cope with the anger as it is escalating. The goal is to teach people who are angry, aggressive, to express their feelings in a positive way, verbally, and without harming themselves or others or destroying property. Workplace hostility. This happens within hospitals. Most hospitals will have a code that is given over the PA system to let you know about any kind of thing that's happening with that needs to be taken care of with workplace hostility. So a code green is what it is at Covenant facilities. When a code green is called, the officers for the hospital come and they will also, transporters will come to provide the manpower to be able to control the patient who's getting aggressive. So this is a sentinel event, and it will be something that, especially your restraint documentation, make sure you do your documentation on restraints. That's something that JCAHO focuses on. So overt actions are going to be verbal outbursts or physical threats. Passive hostility is refusing to perform what you're being asked to do or being uncooperative. And so in 2016, JCAHO added workplace bullying. So new standards of leadership. Ideally, unfortunately, nurses eat their young. So how do you, as a new nurse, find a way to thrive in environments that aren't always positive environments? The best way for you to do this is to be able to find a nurse to act as a mentor for you and sit back and watch. Figure out the dynamics of the floor before you start engaging or trusting many people. Find out who you can trust, who you can't trust. So leadership has established new codes of conduct, defining acceptable behaviors and unacceptable behaviors. There's also a process for dealing with unacceptable behaviors, and zero tolerance means all are held accountable to the same standard. So community-based care, frequently violence doesn't happen in and of itself. It happens when there are comorbid conditions. The way to help decrease violence and aggression within community-based care is through prescription medication, through participation in support groups, and through regular follow-up appointments. Anger management classes help patients to be able to identify frustrations while they are still at a level that they can be dealt with constructively, and helps them to learn conflict resolution techniques. Self-awareness. Be aware of what triggers your own anger. Work on being able to practice self-awareness and be able to recognize when your frustrations are getting out of control and find a way to therapeutically cope with that. Learn from watching experienced nurses deal with hostile and aggressive clients. Be calm, be non-judgmental. And frequently, especially firearm-wise, if in Tennessee, you can have a firearm with you at any time. Now, as you are taking patients' clothes, if you're trying to figure out if they have a firearm, if they have anything in their pockets that would be dangerous to them, the key is to ask them in a non-judgmental way. And when you take usually the firearm will be hidden within their pants. If you take their pants and you drop them onto the chair, listen to hear if you hear anything that seems like it would be a firearm. So if you find a firearm, what do? You maintain a sense of calm. Okay. So, and that may be something that you have to work on, but you want to let the patient know that that needs to be taken by security. Most of the time, people will flat out tell you, hey, be careful, there's XYZ in my pants. And so it's important for you to appear calm, non-judgmental, and non-punitive with it. Okay, if you have any questions, please shoot me an email and let me know. Thank you guys. Bye.